So I've delineated a little zigzag incision on the columella, and by making it zigzag, it hides it better, and you'll see that this ends up being pretty much invisible, and we can show on some of our post-op patients the incision healed. You can't even see it. So I'm very carefully lifting the skin and the tissues off the cartilage. Do you see these two white pieces here? That makes up the M part of the nose. And so I'm just going very carefully, millimeter by millimeter, so I don't injure any of the structures. And you'll really be able to see the anatomy of the nose. So I've elevated all the tissues off the nose, and you can see here, these are the two M's, the lower lateral cartilages. If you pull down, you can see her septum here, there's a cartilaginous bump, and that's what I'm going to take down, and then the bony bump. So if you look inside the nose, you can see this big cartilaginous bump, and I'm going to be shaving that down with the knife. So now I'm going to take down the bony bump, and I have these very fine little files you can see here, and I use that to gently shave down the bone. Okay, so I'm just very gently taking down the bump little by little. So I've taken down her nasal bump. You can see this really beautiful contour. Look at it from different angles. It's nice and straight, no more bump. So now we're gonna look at her nasal tip, and she didn't want me to change it too much. I told her that I would check the diameter to make sure it was a good width, and it is actually. It measures about 6 millimeters, which is ideal. Instead of thinning it or removing the tip, what I'll do is I'll just secure the tip with sutures to make the light reflex a little bit more prominent, sort of like putting the light reflex on contour when you do contouring of the nose, where you put that tiny little shiny dot. That's what I'm going to do anatomically on the inside for her. So I performed a very conservative septoplasty just to harvest this nice straight piece of cartilage that I'm going to use as a strut to support the tip. You can see how nice it is. So you can see here I've marked the two light reflexes. You see when I pinch, it makes a really nice projected tip. So I'm going to put sutures in here to create that shape. So these sutures are going to pinch the tip just a little. She didn't really want to change her tip very much. She wanted just a very subtle refinement. So that's what we'll do. So I've placed this little suture, and you can see how it's subtle, but it does make this side a little bit pointier than this. See how this is sort of just round, not very defined shape. Yeah. So I've placed my cartilage strut here in this little pocket I've made, and then I'm going to suture the lower lateral cartilages to it, so I have really good tip support. So I've placed this stitch, sorry, I'm blocking you, do it again. I've placed this stitch to bring the two pieces of cartilage together to create this nice tip. And this actually makes her much more symmetric, because before this one was lower, it was more round. So this will create a better tip. So now I'm going to very gently break the bone. I just have these tiny little chisels. We'll go a little bit at a time. Go ahead, please. Good, a little. Tap, tap. Tap, 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 tap. So there's a little guard on this, so I can feel exactly where I am, and I'm protecting the eye. Tap, 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 tap. Good. Tap, tap. I think like anything else, rhinoplasty can be done in a very, very gentle way to minimize pain and swelling. Tap, 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 tap. Okay, good, keep going. Tap, 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 tap. Keep going, tap, tap. Tap, tap. Tap, tap. Tap, tap. So now you can see beautiful profile. Nice little super tip break. You can see this tip is projected more than the back. It looks amazing. Now we're going to start the closure. It looks perfect. And now let's look at the 3/4 view. If I tilt her, see this beautiful straight contour into the tip. It looks perfect. You can compare that with the before. It looks very beautiful. So I just wanted to show super teeny tiny little sutures reapproximating the incision. So perfect closure. Looks amazing. So I'm shaping this cast, which when you put it in hot water, it becomes very soft and pliable. So then we can mold it. Go ahead, we'll put it in the hot water. Can I have a right tech, please? You'll see right now it's very stiff. So see how stiff it is? And then when we put it in the hot water, it's going to become clear and soft. I'll just dip it in like a tea bag. So you can see now it's very soft. And we'll just very gently mold it to the patient's face. I've covered her nose with steri strips to protect her. And now we'll just shape the cast so the shape of her nose is perfect. Ailey, look at her nose. It looks so awesome. She's gonna be so happy.
Looks really good.
It's beautiful.